So I want to take a moment to respond to this question. How do you know if the orthotic is made correctly, and what are some signs that would tell you it's not made correctly? So that's a really tricky question to answer, because when an orthotic is made correctly, typically symptoms tend to go down. Now for some people though, the symptoms will get a little bit worse in the first week, a week and a half, because it's sort of like breaking in a new pair of shoes. So you'll remember breaking in a new pair of shoes as being kind of uncomfortable. It causes a little bit more pain in different spots, but as things settle, it all starts to decrease. So it's really hard to say which way it's going to go for who. Like for one person, it might be breaking in a new pair of shoes, and for another person, they might feel relief overnight. I've even had people feel relief immediately upon putting the orthotic in their mouths. So it can really vary a lot from person to person. If you're in an orthotic for several weeks and you feel absolutely no relief and things are getting worse, that's a pretty significant sign that maybe that's not the right fit. And so typically when I give my patients an orthotic, I see them sometimes within a week, sometimes I see them in 3 to 4 weeks to check up on them. And so that's another thing, is if you get an orthotic, your TMJ dentist should be checking up on you to make sure you're okay. And when I say check up on my patients, I have them come back. We go over every single chief concern, every reason they came in. How are your headaches? Are they still twice a week? Are you having jaw pain? How is that? Is it better, worse, or the same? Are you having jaw joint noises? I check their range of motion, and then I do my own sort of therapy on them, and then we adjust the orthotic and go from there. If 2 or 3 visits go by and they're not feeling better and they're feeling worse, that is not a good sign. And that's something that's incredibly, incredibly rare at my practice, but I know it can happen. So I hope that answers your question. Thank you.